For the adductors, and again, these are more local as far as their referral. So there's two places that are most commonly going to be involved here. You're going to get the mass of the adductors right here. So you don't want to be here on the vastus medialis. You want to be here on the adductors. And there's a trigger point right there. Painful?
Not too bad.
Not too bad. Okay? The other one is at the tendon, all the way up near the groin. Now, the best way to do this is actually from behind the patient. Because when I put him in the position I'm going to put him in, his genitalia or her genitalia will be up and out of the way. If I do it from this side, I have him cover everything up, all right, and pull up as much as you can, and then come up here and get on the tendon here, okay? But if I do it from behind, I don't need to do that. So I want you to bend this knee up towards, no, stay on your side. Bend this knee up towards your chest and bring this leg back. Now just relax here, not so crazy, just relax like that. Now you see how that brings everything up and out of the way? Very convenient. And now I can come up here and palpate. I can palpate the whole length of the abductors. Okay? Any questions on that? So you can do this a couple ways. So let's say we've just palpated this side for sake of ease. So bend this knee up towards your chest a little bit. Just a little bit. Good like that. And relax your leg. Okay, now I'm going to just bring them up to my first barrier. Okay, and then push down. Breath in, hold it, hold it, hold it. Breathe out and relax. Okay, the other way to do this, lie face up, please. And again, this takes a little bit of skill in that you're trying to relax this knee. Good. You're trying to feel where that first barrier is. Right there. Now push in. Good. Okay? You can also do this in that same psoas position. If you sit all at the end. Because it does do some hip flexion. Right? So what you want to do here is push down and out. Relax your knee. So what I want to do is I want to push down and out this way. But what's nice is, what's preventing his pelvis from spinning? This, right? So I'm already pushing this way, and then I'm pushing down and out a little bit like that. So again, I'm looking for that first barrier, and I want you to push up and in that way with your hip. Good. Okay? Any questions on those? Sartorius, up, stay in the same position. So sartorius, you want to bring this up to your chest and hold it there. So sartorius is a hip flexor as well. Does some hip flexion. So you want to do a little extension, and then what I'm going to do is I'm going to internally rotate his hip. Try and relax here. Internally rotate his hip a little bit. Feel that? Okay, and then push in. Now, how do you find the sartorius? Okay, slide all the way up. So it's the tailor's muscle, right? Do this. Okay? So have the patient do that, and they can come in here and feel the sartorius all the way up to the hip. And come all the way down like this. And just look for trigger points. Again, it's just local. Tremors we already did. Soleus, face down please. Soleus, remember this has got a weird referral pattern, so you can get trigger points in, basically coming up here and where the two heads of the gastroc divide, that's where you're most likely going to get trigger points. That can refer locally in this area, but it can also refer to PSIS on the same side. So you don't want to forget that, all right? So treating this, you can do it in this position, is very nice. You take the slack out here. I'm going to put my elbow down near his popliteal fossa, and then I'm gonna push up on the calcaneus as I'm taking the slack out of the foot. Okay? For the gastroc, you wanna keep the legs straight. So slide down, please, towards me. Now, where do you find trigger points in this? And again, this is gonna be local. So very often, the lateral head is always a little higher than the medial head. So you come up here, and right at that myotendinous junction, he's got a trigger point right here, okay? And then on the lateral head, it's usually a little bit more medial. So you come up like this, and then go a little towards the medial side, and that's where you're gonna find trigger points. He's got a trigger point here also. Feel that?
A little bit less than the other
Yeah,
side.
it's not that bad. This one's worse. Okay? So you can just do it in this position. And if you want to use the calcaneus as well, so you're going to push down this way when I ask you to. Just totally relax. Totally let go. And I'm going to take the slack out until I feel some resistance. And now push. Good. Breath in, hold it, hold it, hold it. Breathe out and relax. Okay, push again. And I probably should get my elbow over here. Give me a little bit more mechanical advantage. I'm being easy by sitting over here. Okay? Any questions on that? QL. Line your side, please, facing away from me. Put this hand over your head. Bring this bottom knee up towards your chest. This one. Okay? And let this come off the table a little bit. Slide it towards me. Slide back towards me. Good. And just let this kind of hang like this. Okay? So what I'm doing is I'm bringing the ribs up and the pelvis down, and it gives me a little bit of room here to palpate. I'm not in the midline. So if I take this and I go right in the midline, that's not where the QL is. It's a little bit posterior to that. So right here. And very common to have trigger points. What time we got there, Tom? Oh, it's only 9 o'clock. Okay, good. We'll take a break after this, and we'll come back and do it. So I'm in the upper part here and the lower part here. The lower part, you already have him in this position. Why bring him to the end of the table? It's going to be much more stable in this position as well. So roll forward just a little bit and slide back towards him. Bring your butt here. Good. See, now he's in a good position, and I'm just going to reassure him by putting my knee right here, and so I won't let you fall off, okay? Now, I want to use my hand to make it as big as I can and put it on his lower ribs, and I'm just going to put my elbow in my side and push up a little bit. Now, I'm going to take out the slack until I feel that first barrier, and push up very lightly, a little less, okay? So that's QL. QL, the trigger points are local here, and then they'll go down into the pelvis a little bit as well. Okay? Sit up, please, and face that way. So this one, unless you practice it, is really difficult and feels very awkward. But if you practice it, it's a great way to treat this. So now we're doing the upper QL. He's sitting up, so it's upper. Take this hand. I want you to put it face up like this. Okay, and just lean on your elbow. This business about putting it underneath your thigh, it doesn't do anything. I don't know why he was teaching that. Remember he said, sit on the palm? Mm-hmm. I don't know what that does. It just, torques your shoulder in. I don't think it does anything. There's nothing advantageous. And for me, I can't do that because my wrists hurt when I'm in that position. So you don't want the patient to be in any more pain than they need to be, all right? So you just have them, you can just relax here, okay? Now I want you to take this hand and let it just hang here. Don't support yourself with this, just let it hang, okay? I'm gonna wrap my leg around your hip here, okay? So this is really not his hip, but I touched it and said hip, so now he thinks it's his hip, right? So I'm gonna use the mass of my adductors here to grab his ASIS. Now I don't wanna just put it here. I wanna pull back. Okay? And now, I'm gonna take the slack out and feel that first barrier. And push back very lightly into me. Okay? You can also hook the table with your foot like this. If your adductors are getting tired doing this. Okay? Any questions? All right, let's pair up and do those.